Before you refill that prescription, you better check with your doctor. More healthcare providers are de-prescribing drugs, where too many of them are leading to the risks outweighing the benefits. Joining us now to discuss is managing editor Laura Landro and Dr. Kara Tannenbaum, scientific director of the Institute of Gender and Health at the Canadian Institutes of Health Research in Montreal. Welcome, ladies. Thanks to both of you for being here. Laura, let me start with you. Is there an age at which people are more at risk for medication pileups?
Well, obviously, the older you get, the more this becomes a problem. You have multiple chronic conditions. Different doctors are prescribing different things. But, I mean, it can start in your 40s and 50s and middle age when you start to have some of these issues.
So, Kara, what are the dangers then? I know this is something that you spend a lot of time in your professional life focusing on. What are the dangers of too many drugs?
There are a number of dangers of too many drugs. The first one is that the drugs interact with each other and potentially cancel out each other's effects. The other danger is that they could accumulate in your body. If your liver is busy metabolizing one drug and not eliminating the other one, then the medications can accumulate in your body. They could affect your memory. They could cause falls. They could lead to hospitalizations. Some diabetes medications can end up causing blood sugar that is too low. Some antipsychotic medications can lead to you being a little bit too sedated and not being able to enjoy a quality of life. So I think it's both the fact of taking multiple medications together, as well as the age of the body and the effect of the body on the medications and the medications on the body that's of concern.
It's all scary stuff. Laura, are there certain conditions that tend to lead themselves to patients being overprescribed?
Well, I think, as she pointed out, things like diabetes, heart disease, different cancers. Once you've had cancer, you've had a lot of toxic chemotherapy, older patients with cancer, people on palliative care. You have so many drugs, and they're all doing different things and having different, kind of piling up side effects so that, you don't really have the ability to, suddenly they're not giving you any benefit anymore.
Absolutely. And Kara, you've started a website, is that correct, along with a pharmacist to help patients considering whether they should stop taking certain medications? How does that work?
That's correct. We've actually established the Canadian De-Prescribing Network up here in Canada, and we launched a website called www.deprescribing.org. And here we prompt patients to think about whether reducing or stopping medications that may no longer be of benefit or that may be causing harm would be worthwhile. And under the heading Resources and then Patient Information brochures, you can go see if the medications that you're taking, what the harms are based on research, and whether there are better alternatives, drug or non-drug. And I emphasize non-drug therapies because I think that's something that we've underestimated can be used instead.
Very good point. But Laura, aren't there also dangers to suddenly stopping taking a drug? And
Absolutely.
Other ways to mitigate that?
Yeah, I mean, a lot of times, for example, proton pump inhibitors, which are those acid reflux medications a lot of people take, there are new studies that show those can be very difficult for older patients, and then there are reasons to stop them, but you can't just stop them. Usually they wean you off. Maybe you have like a schedule where you go fewer and fewer and fewer, and then you're weaned off, and maybe you make lifestyle changes or do some over-the-counter things.
So it's something that if you are concerned about, you should address with your doctor. Do not all doctors bring it up first?
No, unfortunately they don't. And sometimes you will find your doctor doesn't know what if you have to provide the information as well. It's up to the patient to be really full disclosure about what you're taking, including over-the-counter stuff, because that can interact, as we know, with medications.
It can become so complicated if you're not keeping track of all of it. Now, Kara, are there certain medications or classes of drugs that are potentially always inappropriate for use in older adults?
Well, both Choosing Wisely as well as the American Geriatric Society have consensus about the number of medications that could be de-prescribed. And the sleeping pills, for instance, sleeping pills are really not recommended in older adults because, well, they put your brain to sleep. And if they stay in your body longer than they should, then your brain stays asleep during the day. And that could lead to driving accidents. That could lead to attention and memory problems, falls, and fractures. So those are on the list of pills that should be tapered. And here Laura raises a really good point. You don't want to stop these medications. Your body is probably dependent or even addicted to them. If you stop them abruptly, you'll get more agitated. You won't sleep. So sleeping pills are on the list. For patients with dementia who are suffering from dementia, we recommend that unless it's absolutely necessary, they not take antipsychotic medications that are supposed to de-agitate patients, but sometimes people with dementia just can't express that they're hungry or that they're cold or that they need to go to the bathroom. So using these medications to sedate older adults with dementia is not recommended at all either.
Dr. Tannenbaum and Laura Landro, thank you so much. Very important to discuss with your doctor before doing anything.
Always.
Thank you so much for that.